My name is Khalid Hussain, and I am a clinical nutritionist. Today's video topic is healthy eating with diabetes. Healthy eating with diabetes. Eating healthy with diabetes is crucial for managing blood sugar levels and overall health. Here are some key principles to follow. Choose whole foods, focus on whole, unprocessed foods such as fruits, vegetables, whole grains, lean proteins like poultry, fish, tofu, and healthy fats, avocado, nuts, olive oil. Monitor carbohydrates. Carbohydrates affect blood sugar levels the most. Aim for complex carbohydrates with high fiber content, like whole grains, legumes, and moderate your intake of simple carbohydrates, sugary foods and drinks. Control portion sizes. Be mindful of portion sizes to manage your carbohydrate intake and avoid overeating, which can lead to spikes in blood sugar. Eat regularly. Consistent eating times and spacing meals throughout the day can help stabilize blood sugar levels. Avoid skipping meals. Limit saturated and trans fats. Choose lean meats, low-fat dairy products, and avoid fried foods and commercially baked goods which often contain trans fats. Include healthy fats. Omega-3 fatty acids found in fish, flax seeds, and walnuts can help improve heart health. Use olive oil and avocado in moderation. Watch sodium intake. High blood pressure is common in people with diabetes, so limit sodium intake by reducing processed foods and using herbs and spices for flavor. Stay hydrated. Drink water throughout the day and limit sugary drinks like soda and fruit juices. Moderate alcohol consumption. If you choose to drink alcohol, do so in moderation and with food. Monitor blood sugar levels as alcohol can cause fluctuations. Carbohydrate management. Monitor and control your carbohydrate intake, as carbohydrates directly impact blood sugar levels. Choose complex carbohydrates, whole grains, fruits, vegetables, over simple sugars. Fiber-rich foods. Include plenty of fiber in your diet from fruits, vegetables, whole grains, and legumes. Fiber helps regulate blood sugar levels and promotes satiety. Healthy fats. Focus on unsaturated fats such as those found in nuts, seeds, avocados, and olive oil. Limit saturated and trans fats, which can increase cholesterol levels. Lean proteins. Choose lean sources of protein like poultry, fish, beans, and tofu. Protein helps stabilize blood sugar levels and keeps you feeling full. Portion control. Be mindful of portion sizes to avoid overeating, which can lead to spikes in blood sugar. Use measuring cups or visual cues to estimate portion sizes. Regular meals and snacks. Eating at consistent times and spacing meals throughout the day can help stabilize blood sugar levels. Avoid skipping meals, especially breakfast. Limit sugary foods and drinks. Minimize consumption of sugary beverages, desserts, and snacks. Opt for sugar-free or low-sugar alternatives when possible. Stay hydrated. Drink plenty of water throughout the day to stay hydrated and support kidney function, which is important for people with diabetes. Monitor your blood sugar. Regularly check your blood sugar levels as recommended by your healthcare provider. This helps you understand how different foods affect your body. Work with a dietitian. Consider consulting a registered dietitian who specializes in diabetes to create a personalized meal plan tailored to your needs and lifestyle. By focusing on these principles, you can better manage your diabetes and improve your overall health through a balanced and nutritious diet. Thank you for watching my video. Please subscribe my YouTube channel Bestie Health Facts.